All right, guys, this is Health Nibble number 82, and today we're going to talk about spinal decompression, which is a major part of our office. I mean, for a long time we've been known as a disc clinic, so we offer surgery alternatives. So people that, oftentimes people come in and they're already scheduled for surgery, and then they cancel the surgeries, and we resolve their conditions. So I'm going to explain to you a little bit about how disc herniations work. So disc herniations, disc bulges. Basically, those discs are the shock absorbers of the spine, and they can rupture, and I'll show you that in a second. But the spine should have curves, and we've talked about that before. And when you lose curves, or if you have a trauma, or you are bent over or lifting stuff all the time, it squishes that disc. So if you think of this disc like an ice cream sandwich, when you smash it, the sides bulge out. So I'm going to show you a model of that. So, and to give you a little background, as chiropractors, we look at the spine the way a dentist looks at teeth. We want you to keep your spine for a lifetime. So we try to give people the knowledge and the skill set, and then we do the things they can't do to keep that spine healthy. But just like you go to a dentist, if you have a cavity, they fix it, and then they want you to keep your teeth for a lifetime. No cavities. We're the same way with the spine. So a lot of times, actually most of the time, people come in and they need fixed first before, so to speak, before we can maintain them for the rest of their life. So ideally, you want to keep your spine looking like this. This is a healthy disc. It's nice and fat. It's full of fluid. When the spine is subluxated, so like dentists look for cavities, we look for subluxations. Over time, the disc will thin and weaken, and then you get arthritis. And so this disc, this part, what happens is it will start, can you see that? Mm-hmm. It'll start tearing through these layers. And so it'll tear through the first 2/3 before you ever feel anything. So that's why you see, high school kids and college kids, and they're out doing yard work and lifting up logs, and you think, how, I'm 41, and I'm thinking, how in the world could they do that without hurting their back? But they aren't. They actually are hurting their back. They're ripping through these first layers, and then you don't actually feel anything until it hits the outer third. So, oftentimes when people get injured, they're like picking up a cup of coffee and then they can't get up. Or as Chelsea, and we'll talk to her in a minute, picking up a car seat, right?
Correct.
Yeah, car seat. So, with a baby in it or not in it?
With the
baby in it, okay. So, the side, what happens is it starts ripping through those layers, and it pops out and it hits on the nerve. And so, ideally, you want a bunch of space for that nerve. When it hits on the nerve, then it goes down your leg, that's sciatica, down your arm, and that's what people have surgery for. So, what the medical, basically with medicine, you're going to get drugs and surgery, and some physical therapy. And when they have surgery, they try they go in and they cut this out, or they cut out the bone. Sometimes they put shots in there to shrink that up, and we actually utilize that every once in a while for our really tough cases. Once we, get them through, if they're a 10 out of 10 and we get them to a 2 out of 10 and pretty stable, sometimes we need a shot to get them to a 0. But model for decompression is, since this is like an ice cream sandwich and you squish it and the sides bulge out, we pull that apart and it rehydrates the disc. And we've had a half a dozen cases or so where we've had pre-MRIs and post-MRIs, and we've seen that actually happen. See the rehydration. We don't do that on all of our patients because it's not medically necessary once a patient is well to get a post-MRI. That's more for just educational purposes. So, and if patients want to pay for that, they can do that. So, I'll show you here. This is a poster. Actually, if you can just come over so I don't have to listen. I just pulled it off the wall. So this is an MRI, and you can see the discs are white and they have fluid, and then this one's a little darker. But this is what the disc herniation looks like on MRI. And so this is the spinal cord, and it's putting that's an extruded disc. It's actually putting some pressure on there. And then this is post-decompression. So sometimes we see them and they're symptomatic and they even look like that, and we get them to look like that. So, we've seen all different sorts of them. and this is where they're really getting a bunch of pressure on the spinal cord, and then it frees it up, or on the nerve right here, and then it frees it up, and you know, it doesn't. If you look at MRIs on 10 asymptomatic men, 8 of them have disc herniations. So just because they get an MRI and they have a disc herniation, doesn't mean they have like pain shooting down their legs. So what we want to do is make it so they're functional, so it's healed enough where they don't have any problems. So so this is what we use. This is called a DRX. We've been doing this for 13 years, and it's a rare occasion that, I mean, we may send, and I'm definitely willing to send people to surgery, but you know, it may be 1 every 2 years that we send to surgery, and this machine is full all day. So if you can just scan that so they can see it. This is Chelsea. So Chelsea had, so you know, typical injury case, probably had, you know, the disc layers were torn on the inside. She goes and, you know, lifts the kid up with a car seat, hurts her back, and that was what, 3 years ago? Mm-hmm. And then so she's done shots, physical therapy. Mm-hmm. What else? Other chiropractors.
Coming here.
Yeah. And so, you know, I'm not, we send people out not for spine physical therapy. I mean, we do that here, but, you know, I'm a huge advocate of physical therapy. Chiropractic, we're just really good at getting disc cases better, because some of them work better with flexion and extension. You just every disc has a little bit different character. Some of them do better with more weight, less weight, different angles. So we're just pretty good at figuring that out. And Chelsea reported today 60% better.
Correct.
So she's 60% better, and she's a little bit of a blend. We talked about structural care before, so we're doing decompression for the disc, which is established on MRI. Mm-hmm. You had 2, right?
Yes.
Yeah. So 2 that were established on MRI, and then she has some structural stuff too that's driving the whole situation that we address after this. So that's your Health Nibble on decompression, which is a surgery alternative.